Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Breckner, president at R3, and each episode, I sit down with our founder and CEO, Dr. David Greene, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine.
Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm here today with our president, Samantha Breckner. How are you?
Thank you for having me. I'm doing well. How are you?
Good. Can't complain.
Good.
We're actually here in Tijuana today, visiting our clinic. We're at Hotel Lucerna, where we stay and where most of our patients stay. Mm-hmm. It's a beautiful setting, a lot of lush vegetation.
Yes.
But for today, I am going to answer some of Samantha's questions about autism and stem cell therapy.
Yeah, thanks Dr. Greene for answering some of my questions. A lot of it is, general FAQ that we get from patients all over the world. So I'm going to start off with, can you tell us who is a candidate for stem cell therapy, with autism?
Yeah, so over the last few years, the diagnosis of autism has been expanded to an umbrella term called autism spectrum disorder,
Sure.
which includes not just autism, but also Asperger's syndrome and something called pervasive developmental disorder. So the incidence of ASD is higher now than ever, actually, around the world. And when we look at where our patients come from for autism, it is everywhere.
Yeah.
It's not like it's just focused on several regions.
Sure.
It's ubiquitous around the world. So when we look at who is a good candidate, typically these are children whose parents relate to us that they've been through all of the traditional therapies that exist. And it's no different anywhere really in the world with regards to speech therapy, behavioral therapy, occupational therapy.
Right.
Those are really the three main ones that we hear of. So when they come to us and they have these complaints that their children have either global developmental delay or various delays that they're experiencing, they have hyperactivity, they have these repetitive behaviors that are typical for ASD, they aren't able to have substantial discussions with people because they don't maintain eye contact, right. And they don't really have the vocabulary to be able to do that. And a lot of them have never spoken at all, really. Right. They have the ability to speak, like they're looking at YouTube and they can repeat some of the verbiage and songs that they hear. But so they have that, they have really minimal eye contact, and they have hyperactivity and sometimes aggressive behaviors towards friends and family. And they've tried, once again, these three types of treatments that have given them benefits to a point, but they hit the proverbial brick wall.
Right. So which centers of R3 do we treat ASD?
Good question. So we have clinics in 7 countries right now, mm-hmm. And growing. And we do these treatments in, right now, Mexico. We're in Mexico right now.
Yeah, we have 3 clinics in Mexico.
We do. Tijuana, Cancun, and Puerto Vallarta. Brand new, exactly. So we have a beautiful center in Manila in the Philippines. We also have one in Istanbul in Turkey, where we do a lot of autism ASD treatments. We also have one in Pakistan, in Islamabad. We've been there for 8 years. We've done hundreds of cases of autism. India, right now in New Delhi, and South Africa in Johannesburg.
Wonderful. That's great. I think everybody has lots of options. What about the United States?
We've done some therapies for ASD, and that's based on the physician-patient interaction, right? That's a decision they make. That's how medicine works in the United States. However, right now we don't do conscious sedation in the United States, and because we're still doing a lot of intrathecal applications where we do injections into the back for the spinal cord, now more and more we're doing more intranasal therapies, and that's working fantastic. So we do them, it just has to be the right scenario.
Sure. And intranasal, I know we have the SphenoCath, but we also have our new NeuroMist procedure in the United States. So, it's actually, I think you said 500% more effective than just an IV, right?
That's right, yeah. So years ago when they did the autism studies at Duke University, that was started 8 years ago with umbilical cord blood. All they did it for was IV. There's one of our patients. Hey, buddy. So when they did the umbilical cord blood IV, it worked fantastic for these children. So it's interesting because with an IV, you get about 1% of the cells getting to the central nervous system. The exosomes, on the other hand, they're so small, they don't care about the blood-brain barrier. So plenty of those will get to the central nervous system. But when we do the NeuroMist procedure intranasal, we get 500% more into the central nervous system. So it's been a fantastic addition to what we're doing for these kids.
Absolutely. I mean, and we'll even do that outside of the United States too. It's just, a great option if you kind of wanted to stay in the U.S.
Absolutely.
Totally.
Yeah.
Well, I think my next question that's very popular is, do I or the patient need to match up with the donor of the cells?
So it's a great question, because you would think that since we're giving donor stem cells to an individual, that you would need to have some sort of a matching process. But it's actually the opposite. You don't need to do that. And the reason is that when you use umbilical cord stem cells from a donor, and we get those after a scheduled C-section, the umbilical cord stem cells are immunologically privileged. They don't have what's called MHC2 markers, so that's what would cause a potential rejection reaction in the recipient. But since they don't exist in those stem cells, you don't get a rejection reaction, so you don't have to be related to somebody in order to be the recipient. And we get that question all the time.
Oh my gosh. Yeah, we really do get that all the time.
Oh, see, 80% of patients, families ask that.
Yeah, absolutely. So now tell me about some of the improvements that we've seen in our patients.
Well, when it comes to autism spectrum disorder with stem cell therapy, parents always want to know what are going to be the exact improvements that are seen, with my child. And the answer is, we can't give you an exact answer. Because patients are different, whether it's an adult or a child, they react differently. Now, thankfully, 85% of children who get the treatment, we notice substantial improvements. And parents tell us what these improvements are. So normally we see improvements in two categories, predominantly. One is in behavior. So a lot of these children are tremendously hyperactive. So hyperactive that a lot of schools will not allow them to be enrolled. Now, the other problem is that a lot of these kids are aggressive, and they can be aggressive towards their friends, towards their family, and that can, expose itself in various ways. So from a behavior standpoint, we typically see dramatic improvements in both of those. Okay? So they get less hyperactive, they get less aggressive, and it's usually dramatic, very, very noticeable. So the other category is in communication. So a lot of children who are presented to us, they either have never spoken, or they have a little bit of vocabulary, and the additional issue is that a lot of the vocabulary they do have is basically just repetitive from what they're watching on YouTube, and that's not enough to have a discussion.
Right.
And sometimes they'll be able to follow commands or communicate their needs, but wouldn't it be nice if they were able to, verbalize what they're experiencing or what they need or whatnot? And oftentimes we see that happen after the procedure. Now, it doesn't happen right away. It may take a few months to see
healing cycles.
Yeah, exactly. But the interesting thing is that, we were talking earlier about the child. One of the children were here to film these couple of days. TJ. It's been about 9 months since TJ's treatment, and the dad was telling us that recently he came up to his mom and told her, he said, "I love you." Never said that out of the blue like that. Now, he had said it when she said it to him.
Right. But for him to just say it out of his own will, and it's a different story, right?
Right. It's a very emotional, type of thing for him to come up out of the blue and say that. But those are the types of things that we see, is that the eye contact improves, attention span gets better. And these are very noticeable to the parents, to the, family. And it changes lives.
It does. Yeah. So how many treatments would you say a patient needs? Can we even answer something like that?
Well, yes and no. I can, evoke statistics.
Sure.
Right? So when children get improvements after an ASD stem cell procedure, usually the improvements are theirs to keep, okay? But not always. So I think TJ is a very good example. He's 8 years old. Now, all of the vocabulary improvements that he's seen, the attention span, the interactions with his brothers and sisters, he's kept. All right. The only thing that has regressed a little bit is what his dad refers to as his irritability. So he's a little bit more irritable than, but not nearly as bad as it was, before the first treatment.
Right.
So for the most part, these improvements are the child's to keep. But we can't say that for 100%.
Right.
We can't, give them the assurance that these improvements are a done deal and they're never going to. So here's what we typically see: is they'll start, let's say, at the baseline, and then they get improvements, and they may drop a little bit. But if they have a repeat procedure, it's a stair step. So they go back up to a new baseline.
Right.
So here, and we've had quite a few families who bring their child in for, we've been in Mexico now for 7, 8 years. Mm-hmm. They've been coming every year.
Right.
And they continue to get these stair step improvements. And it's so fascinating to see how much it changes their whole family's life. I mean, if they don't have to spend, 50, 60, 80, 90% of their time keeping their child out of trouble, so to speak, then it really frees up the mom and the dad's time,
right,
for the rest of the family,
right,
or for their own, needs, so to
Sure.
speak.
Sure.
So yeah, that's I'd say about 2/3 of families do opt for repeat treatments.
Yeah, I've seen that too. Another frequently asked question that we get are, what are some of the side effects of stem cell therapy?
Yeah, it's a good question. Obviously, you want to know what you might be in store for, during or after a treatment.
Right.
As with any stem cell procedure that our providers do around the world in children or adults, we might see something like lightheadedness, dizziness, maybe a little bit of nausea, possibly some vomiting, maybe a low-grade fever for
some flu-like symptoms.
Flu-like symptoms for a day or two. Most of these resolve. They're mild to moderate side effects. Now here's one thing that was seen in the Duke University study, as well as the Panama study, and I think another study, it was out of China maybe. It's the same thing everywhere. A small fraction of autistic children do experience increased hyperactivity for about 2 weeks after the procedure. And obviously parents get wondering what the heck is going on.
I mean, why do we think that is?
We don't know.
Okay.
We just know that it's short term.
Okay.
And then then it starts to flip the other way.
sure.
Yeah.
They get so excited about their stem cells.
Yeah, right, exactly. Their neurons are jumping out of there.
I'd be excited.
Yeah. Bing, 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 bing.
Very nice. And that's not just in our patients with ASD. I mean, that's just in general with stem cell therapy. Those mild flu-like symptoms are normal.
Exactly. Yeah, and people ask, well, why does that happen? And I have some theories about it. I don't know that we have an exact answer. But my philosophy is that, like, for instance, we do a lot of treatments here in Mexico and around the international clinics for autoimmune syndromes, diseases, and they do wonderful. But most of them do get flu-like symptoms actually for a few days. And I feel like it's the immune system sort of incorporating the cells and them starting to do their job, saying, hello, I'm here.
Right. Well, inflammation promotes healing. I mean, kind of a good thing if you think about it. I mean, obviously it's not bad per se to not experience any symptoms, but experiencing symptoms and not, both are normal. Would you say that?
Well, it's interesting you brought that up, because there's good inflammation in the body, because inflammation, as you said, is the first phase of healing.
Right.
And then there's harmful inflammation.
Right.
When it becomes too much and too chronic. All right? And that's not just in like the gut or the various organs. It's in the brain too. So when you have traumatic brain injury, when you have a stroke, when you have autism spectrum disorder,
right,
there is chronic neuroinflammation, and that's one of the theories of why we think stem cell therapy works so well. And let me just,
because the stem cells attack inflammation.
exactly.
Right.
So let's just talk that through. All right, you get chronic neuroinflammation. We get the stem cells and the exosomes to the central nervous system. It reduces that neuroinflammation and the oxidative stress that comes along with it, and it frees up your central nervous system to create more neurons, more glial cells, more Schwann cells, and it creates new neural networks in the central nervous system. So when parents ask us, well, should we do, speech therapy, behavioral therapy after the stem cell therapy? The answer is absolutely.
Right.
Because that is a fantastic time to create these new neural networks that can give these improvements that we not routinely, but 85% plus, we get great improvements.
Well, I think that makes the most sense. I mean, if it were my child, of course. I mean, during that healing period, why not instill all of these great techniques while, we can form these new links? I mean, it all makes sense.
It does, and we see it play out in real time,
Yeah.
Over the last decade of doing these procedures.
Right.
So when our providers speak with parents, we talk about how, for us, the track record has been high safety, high benefit, and along with high safety, low risk.
Yeah. So, yes, we have high safety and it is low risk, but have we ever seen an adverse event?
Well, overall, we've done over 26,000 stem cell procedures now. We've seen 3 episodes of anaphylaxis. We don't know what the anaphylaxis was in response to, because there was one here, there was one in, I think, the Philippines, and one in the United States, actually. So it could have been anaphylaxis, a response to the cryopreservative.
Right.
Although here in
Maybe
Tijuana,
the Myers cocktail.
it could be the Myers cocktail. Here we don't use cryopreservative in Tijuana, so I'm not sure why. But in all 3 cases, the doctors just gave epinephrine. We have epinephrine everywhere, and it cleared up within a minute.
Okay, great.
So
Yeah, I'm sure that can relieve some of the scary thoughts that people are thinking. I mean, 3 out of 26,000, and we were able to resolve them in under a minute. It's pretty good statistics, I would say.
yeah, I mean, the statistics are fantastic for the benefit and for the risk
Right.
profile
Right.
that we've seen.
So my next question, tell me about the cost of stem cell therapy for ASD, specifically internationally.
So when it comes to the cost of stem cell therapy, one of the things that I strive to do when I started the company 13 years ago was to try and keep the cost low. I'm not looking to be the cheapest clinic out there because we can't, because our safety standards are so high. Right?
Yeah.
So when you keep your quality standards in line with the most rigorous regulatory agency in the world, the US FDA, then I think it says a lot when we've had so few adverse events. And the adverse events we talked about have been mild to moderate and temporary.
Right.
So you have very high safety standards, and you have very high standards for the mesenchymal stem cells that we produce. So years ago, all of our PhDs sort of combined brain power and created the IntelliCell. And the IntelliCell is named because it is the smartest stem cell in the world. When you have the highest amount of mesenchymal stem cell surface markers, you have the highest amount of colony forming units,
right.
You have the very specific shape, the morphometry of mesenchymal stem cells. When we take those, and those are the ones we expand to make more and more, you make it affordable, and we keep the very high safety and the activity of the cells. The outcomes are tremendous,
right.
But it does allow families to get repeat treatments without the proverbial breaking the bank.
Right. So you were also just talking about expanding of cells. I know that there's, recommended regulations. Where do we stand internationally with the culturing and expansion and generations of cells, all interchangeable words?
Yeah, exactly.
You know.
So, in the United States, you're not allowed to use cultured or what's called expanded stem cells.
Right.
It doesn't mean we can't do the therapies, but we can't use expanded cells. So as a result, the procedures that we do are a little bit more expensive.
Right.
Internationally, we are able to use expanded cells, and through a lot of research over the last 2 decades, we know how to expand the cells and how many times you can go, 1 to 2, 2 to 4, 4 to 8.
Right.
You can only do that so many times before the cells become non-functional.
Right. Start getting mutated.
Yeah, the scientific term is senescent,
Okay.
which means non-functional. And after a certain point, you get DNA damage, you get mutations, you get too much inflammation with growth factors, and they just don't work well. So our lab here in Tijuana, we've tested many biologics from competitor clinics and labs.
Right.
And more often than not, I kid you not, it is a graveyard
Oh, goodness.
when we look under the microscope.
And, is it because we're thinking their safety isn't as high? Are they expanding way past the 6th generation?
I think it's both. I think there's 2 issues that come into play. So we do a lot of price matching, and
We would rather you come and get the legit stuff.
that's right, yeah.
You know.
So because I want people to get great outcomes. There's nothing worse than when you go through a procedure and then we get the call. I went to, I'm not going to name other
So-and-so
clinics, but and I paid, let's say $3,000 US for 100 million stem cells, and I'm like, you had me at 3,000. I mean, that you just can't even make quality and safety with stem
not
cells.
with all that testing too.
Exactly.
We're going to spend the money on the testing. This is going in your body. That's what people have to realize. Like, this is something foreign, right? Going into your body, and you should probably know and trust what you're putting in there, right?
I had treatment here at our clinic myself 2 weeks ago for my shoulder, and then I had an IV, and I do that a lot. And I wouldn't do that if I didn't trust what was going into me.
Right.
You've had treatment. Our parents have had treatment. It's not like we don't trust what we're doing.
Right.
And the problem is with other clinics, either they're expanding it way too many times to where they're not functional, or they're skipping some of the safety steps.
Right. Right. Well, we're perfect examples. We look great.
Yeah,
So,
yeah, exactly. This is all natural, baby.
Yeah, stem cells.
Well, thank you very much for joining us today. Visit us online at r3stemcell.com. We have over 900 educational videos on our YouTube channel. And
check out our new podcast, Stem Cell Genius, where I, your host, Samantha Breckner, interview our founder and CEO, Dr. David Greene, and we answer your most pressing questions.
Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.